Hello guys, good morning and welcome back again to my channel. My name is Anekan. In case this is the first time that you're seeing me, I am a medical school content creator and I make videos about lifestyle as a medical student and what medical school entails. I've been creating a playlist on second MB. If you have not checked out my previous video, please go ahead and check it out after this one. Guys, I've been getting a lot of recommendation from YouTube, yes, YouTube, on how to study anatomy. YouTube have been saying that this is what most people search for. Money pass taking the light. But back to what I was saying, YouTube has been saying this is what most people search for and I should definitely make a video on it. Here I am guys, making the most requested video, how to study anatomy. If this is a video you're interested in, please stay tuned and keep on watching. Now guys, when it comes to anatomy, I think the number one issue is that people forget that anatomy is a visual subject. You have to see anatomy as a visual subject. Anatomy is not your typical theoretical subject. These things exist, and except you're planning to run away in medical school, especially for the preclinical arm, before you start your clinical rotations, you do anatomy. Anatomy takes up roughly 60% to 80% of your time because it is divided. In our school, we actually do 4 parts. Well, now they have introduced a 5th one, but I didn't do that. They do gross, histo, embryology, then in 300 level you do clinical demonstration. Now genetics have been introduced, but us, for our set, we didn't do genetics, but the current set are doing genetics. Guys, I'm going to be telling you every single thing about anatomy. Guys, for what I said earlier, that is the number one thing you should always remember. Don't ever make that mistake of forgetting that anatomy is a very visual subject, and because it's a visual subject, it has to be studied as a visual subject and not your typical theoretical subject. Guys, I have some books that I'm going to recommend, although I was planning on doing a separate video where I talk about more books because I don't have all of them, to be honest, but I'm just going to talk about it. Now, tip number 2, go for your dissections. Please, please, please and please. The problem people have with anatomy is that they don't go for dissections. If you don't go for dissections, you can't visualize what you've been reading, you can't visualize what you've been hearing, some things are better seen. Like for our school, we have extensive dissection periods lasting for over 4 hours or even more, where we dissect real life cadavers. Cadavers are dead bodies. You don't even really have a guidance or a form of tutor teaching you. You actually do the dissections yourself. They just give you the body and they are like, explore. You have been taught in your theoretical classes. Now it is time for you to see the real life visualization of what you have been taught. Basically, you are given bodies and you're asked to dissect. I know some schools already have dissected specimens. Please make sure you go for your dissection labs. Make sure you visualize the bones. If you have osteology labs, we didn't have particular sessions for osteology. Nobody really came to teach us, oh, this is the femur. Everything we had to learn on our own. For the bones, they will just provide you with the bones, then you have to learn it. Go for your dissection classes, get the bones, touch it, feel it, correlate it. Like try, and in class they told me that this is where the cubital fossa is, and they said the contents were the median nerve. You should be able to see the median nerve, bifurcation of the brachial artery. I should see the brachial artery dividing into 2. Then tendon of the biceps brachii. I should be able to see the tendon of the biceps brachii and superficial branch of radial nerve. Although the superficial branch, as the name implies, superficial branch, if you're not very careful, which I assume, because as amateur anatomist or amateur student studying anatomy, you most likely would cut the superficial branch of radial nerve, so you might not visualize it, but at least 3 out of 4 you should see as many structures as possible. There is this secret. There are 2 people in dissection hall, the ones who always teach, who are always talking, and they are, when I say talking, I'm talking about productive talks now. They are always trying to explain one thing or the other, or just explain what they have learned or what they have seen, and they are the ones who sit quietly listening and trying to garner information, sifting through the crowd, eliminating the noise and focusing on the key subject and the key purpose. you have to fall into one of these categories in order to pass anatomy. Either you're the listening type or you're the talking type, but fall into one of these categories. That is the smartest way to study anatomy, because whenever you go to read the material now, it's going to be much easier because you have seen it in real life. Yes, guys, I have my jotter here, my powerful jotter of many points. Pardon me if I'm looking now. The next thing I'll advise, like I said, anatomy is a visual subject. Make sure you always study with an atlas. It is very important, especially if you're starting in region for the first time. I'm going into abdomen and I don't know what abdomen entails. Well, for us in our school, we study our anatomy regionally: upper limb, lower limb, abdomen, thorax, pelvis and perineum, head and neck, neuroanatomy, and we go in depth, we delve in depth. I know, like some other medical areas, they somewhat don't go as detailed as people who are doing medicine or who are studying the course. And that's one thing I've observed, but yeah, back to what I was saying. Make sure you study with your atlas. If you're learning abdomen and it's the first time you're going to be reading or looking at anything in abdomen, open your atlas. As you're reading your textbook, try to look at it in your atlas, because you most likely wouldn't go home with your cadaver, but just try as much as you can to look at it. If your atlas says the stomach is located in the epigastric region, or this abdomen is divided into quadrants, try to see this quadrant on your body on the surface anatomy. Then when you go into the viscerals and they tell you that this one is medial to the stomach, that one is lateral from the stomach has the following relations, like the pancreas, the spleen. I want you to be able to visualize and see these things. It will stick better, honestly, than for you to just cram. Anatomy is difficult to learn when it's just solely based on memorization. Although memorization is key, but at the same time, anatomy makes it easier by showing you it's not like you're memorizing lies, you're memorizing truths, you're memorizing things that actually exist. That is the thing with anatomy. Then another tip that I would give is to, like I said, read the right books. Books influence your learning pattern, it influences your thought pattern. People don't realize this, and like I always say, books influences your thought pattern. And like I always say, what book you're reading, I can tell how good you are from the books you're reading actually. Now, one of the advice I will give you is that read the right books. Whenever ask for the recommended text, they are usually recommended texts for each maybe for each level, for each class. If you can ask from your senior colleagues what books are recommended here. But like I say, treat your books as resources. Don't be overly emotionally attached to one book. I don't like doing that, although there are some books that I swear by, but at the same time I realize that these books are meant to help me, and if I'm not getting a piece of information from this book, I might as well move on to try other resources instead of saying, oh, is this book and is this book that I will die in. That is not how medical school works. You have to be flexible, you have to use the right set of books. I have with me here some books that I use. I'm just going to tell you something briefly about them. Now, for embryology, yes, embryology is a very, I don't know how to put it, it's kind of abstract, to be honest, because you're learning about the various developmental stages that occurs in the womb. Basically, the embryo undergoes this to become this, how does the heart develop, how does the lung develop. So it's abstract, you kind of don't see it, but if you go on YouTube, you can find like video resources showing you how the heart is formed and how the lungs are formed. I didn't really like embryology so much when I started. It was the bane of my existence. I didn't really like it, but one thing I found out was maybe one of the reasons I didn't like it was because of the material I was using, and immediately I switched it up, everything started to make sense to me. Now, the book I have here was the one I initially tried. People swear by this book, which is in the Bergson human embryology textbook. People swear by this book, but to be honest, I don't swear by this book. I have tried reading this book. That's why you see this book is new. I have tried reading this book, but I realized later on that this book wasn't for me. To be honest, the book that was for me, because like I said, I didn't like embryology. I needed a book that was legit for dummies, that is like a book that would take time out to explain each concept step by step, and that was when I found Human Embryology by Vishram Singh. This is in the Brexin. I'm not talking about Brexin. Vishram Singh's embryology book. Chef Kiss. He did a beautiful work at writing that book. Just try it out. Immediately I changed to that book, my embryology knowledge skyrocketed and everything changed. Histology and embryology did make me cry, honestly. Histology is the study of tissue, study of cells. You're looking at the microscope and you're trying to identify, is this from the pancreas? Is this from the lungs? Why is this from the lungs? Why is this from the pancreas? Why is this from the heart? Why did they say that this is a tissue from the eye? Why are they saying this is from? You have to know the reason why some things are the way they were. I hated general histology. I think that was my problems. I never liked general histology. I did like systemic to some extent, because now the differences were very clear and distinct. But general, I felt it was just all talk and talk and talk and talk and talk and talk. I didn't really like general, but I'm just going to show you the book that I tried using. But like I said, I didn't even use this book because I always say I needed a book that was made for dummies, and the book that I had was in the Brexin textbook of human histology. People swear by this book because this book has an atlas. The atlas was helpful actually, because I could go through the pictures and just see how it looks. But to be honest with you, I didn't really read this book much. I read Histology by J.P. Gonzaragan, Practical Histology Guide. That one is a practical histology book, but it was summarized. It had pictures and different illustrations. It was straight up what I needed, like to have the core fundamentals of histology. Saying like it's a subject that I don't even really like that well, but it really helped me a lot. At least I didn't fail my histology, no matter how much I complained about it, as well as embryology. Biology, that Vishram Singh book, please try it out. I'm telling you, the book single-handedly took me from a place of just being low and average to having high knowledge. Sometimes I answer some questions and I'm like, oh my god, you knew this, you knew the manifestation of this, like wow. That book, Chef's Kiss. Now, for gross anatomy, the Baba, the lion, the one that you spend almost 80% of your time reading, which is gross anatomy, baby. Because sometimes I'll be reading and I'm not feeling this book. I'm not feeling this book for this region. Let me go ahead and find another book. Like I said, you can find soft copies of some of these books from your senior colleagues, from Telegram, from Z Library and PDF Drive. I think you can find soft copies there. Now, for the first one is BD Charles. I actually have a complete set of this book in terms of series, because this was the first book that my parents actually got for me. Honestly, I didn't recommend this book, honestly, but they just got it and it was helpful. I think the helpful part of this book were the flowcharts that came with it. Oh my god, let me see if I can find I can't find it, but this book came with beautiful, this BD Charles set, it came with beautiful flowcharts that I hung up on the walls of my room. When you come into my room, you see arterial tree, venous tree, summary of head and neck and neuro, in terms of maybe arterial supply of the brain, circle of Willis, or head and neck. You see, how will I put it, all the ganglion, like aortic ganglion, like the parasympathetic and sympathetic ganglion. Basically, you see the schematics of each of the different ganglion, sublingual, submandibular. Like, it had those beautiful charts and it blew my mind away. Now, the one that I used the first book in the series, which was the upper limb and thorax. I thoroughly enjoyed that book. I read that book from cover to cover. I finished upper limb and thorax in that book because, like I said, I loved the book. As we moved on to the next set had abdomen, pelvis and perineum, and I think that was it. Abdomen, pelvis and perineum, and lower limb. I hated the fact they combined these three regions together. I think that was the beginning of my problem, because when we were doing abdomen, there were some selected topics that were for abdomen, but when I'm reading the textbook, I found it difficult to be able to clearly state that now it's okay, you're reading above, you're reading out of abdomen and I'm moving into pelvis, because there isn't a clear distinction between abdomen and pelvis and perineum. But like I said, at school we had like clear designated topics for abdomen and for P and P. I found it mixed up, honestly, because it was like I was over reading and I was under reading, so I didn't want that. And my lower limb, and the book was now a bit thicker. I was like, what the hell, what is this? I had to like find a different book for thorax, abdomen, pelvis and perineum. Now the books I used in this series is the one that I used, that I fell in love with. I even had to ask my parents to get me that one. Honestly, I had to buy it because the book was just so good. Is this one, Clinically Oriented Anatomy. Yes, if you look at the pages of this book, you see underlined words, you see, like, it will tell you that I clearly thoroughly enjoyed this book. I was initially reading the soft copy of this book until I was like, what the hell, why all this stress? Let me just get the hard copy, since I clearly was enjoying this book. But the issue is that the book is a thicker book, but it has clinical boxes. Yes, it has clinical boxes, and sometimes you'll be asked to write the applied anatomy of a particular topic you're reading. This book really helped me with that, because for a topic you have so many clinical correlation, so you never run out of clinical ideas and clinical correlation. I did read this book for lower limb too. I read it for abdomen, pelvis and perineum, thorax and lower limb. Like I said, I even started reading it on my laptop. Aside from this book, now the next book that I would recommend, I don't have the hard copy of the book, is Grey's Anatomy. But the issue with, sorry, before we proceed, the issue with Cave More is that they didn't have neuroanatomy session, and their head and neck, when it wasn't so in detail, so that was why I had to dump the book. But for head and neck, I used Vishram Singh, not the selective anatomy, like Vishram Singh main textbook. Now Vishram Singh's textbook of head and neck, basically, in this series, I used that one. Then for neuroanatomy, it was a different ball game. I combined Indebrexin textbook, which, sorry, not Indebrexin, I combined BG Chaurasia. I combined BG Chaurasia with Vishram Singh. I combined VG Chaurasia, Vishram Singh and Indebrexin. All the two Singhs and Chaurasia, I combined all of them for neuroanatomy, because neuroanatomy was just a pain in the ass. But if I was asked to pick one, I would say read Vishram Singh clinical neuroanatomy. Please take note, Vishram Singh clinical anatomy. It has everything beautifully written for beginners. You don't have to stress too much, straight to the point, has a lot of information, but important information. That I'll recommend that book in the series. Now guys, for the most important, if you don't have any book, you should have this one, because this is the Baba Odogo, which is this one, Atlas of Human Anatomy. Like I said, Frank Netter's Atlas of, that is what it's called, Frank Netter's Atlas of Human Anatomy. I had this one in hardcover. It has beautiful pictures and illustrations, and yeah, it has beautiful drawings and diagrams too. That book, if you have any, before you even read any topic in anatomy, I will advise you to go through the atlas. Even while you're reading it, please, for a first timer, make sure you're reading it with the atlas. normally what I used to do, like to save time, is that I would go through the pictures in the atlas just to look at it before I start reading. Then when I'm reading, I'll be picturing the images that I looked at. If I forget anything, I'll go back to the atlas so that I save time and I'm not wasting time doing back and forth, back and forth, back and forth. We good? I said anatomy is a visual subject. Please treat it like one. Don't treat it like a theoretical subject. It is definitely not. If you treat it like a theoretical subject, you will hate yourself, you will hate the course, because these are real life things. They are things you can see. They are like blood vessels in the human body, and it will be very much appreciated in surgery, especially because you see the cutting into the various tissue layers, and you see the organs, and it will just make sense. All your anatomy knowledge will come into play, and you get to see it dance around surgery and helping to bring back a patient. But guys, draw and make notes. Please don't forget to draw, annotate, draw as much as you can, and make as much notes as you can. Until next time guys, bye.